The world is currently grappling with a pandemic that has caused unprecedented disruptions to our daily lives. In the midst of this crisis, one thing has become abundantly clear. Vaccination has a crucial role to play in protecting ourselves and our communities. One vaccine that has been making headlines recently is Adacel, a vaccine that protects against a range of potentially deadly diseases. In this video, we'll take a closer look at Adacel and why getting vaccinated is more important than ever before. From the risks of infectious diseases to the benefits of herd immunity, we'll explore why Adacel is a vital tool in the fight against illness. So, if you're curious about this vaccine and want to learn more, keep reading to discover why getting vaccinated with Adacel should be a top priority for everyone. What is Adacel vaccine used for? Adacel is a vaccine that is used to protect against 3 serious diseases: tetanus, diphtheria, and pertussis. Tetanus is a bacterial infection that can cause severe muscle stiffness and spasms, while diphtheria can cause respiratory problems and heart failure. Pertussis, also known as whooping cough, is a highly contagious respiratory infection that can be especially dangerous for infants and young children. Adacel is designed to provide immunity against all 3 of these diseases, making it an important tool in the fight against infectious illness. Adacel is a combination vaccine that contains inactivated forms of the bacteria that cause tetanus, diphtheria, and pertussis. It stimulates the immune system to produce protective antibodies against these bacteria, helping to prevent infections and their associated complications. Adacel is recommended for individuals who require booster doses of these vaccines or as part of routine immunization schedules. The importance of vaccination. Vaccination has long been recognized as one of the most effective ways to protect against infectious diseases. By introducing a small amount of a disease-causing pathogen into the body, vaccines stimulate the immune system to produce antibodies that can recognize and fight the disease. This process creates immunity to the disease, which can prevent future infections. Vaccination is important not just for individual health, but also for public health. When enough people in a community are vaccinated against a disease, it becomes much harder for the disease to spread. This phenomenon is known as herd immunity, and it can protect vulnerable members of the community who may not be able to receive vaccines themselves, such as infants or people with compromised immune systems. The risks of not getting vaccinated. The risks of not getting vaccinated can be severe. Infectious diseases can cause serious illness, hospitalization, or even death. In addition, some diseases can have long-term effects, such as brain damage or paralysis. For diseases like tetanus and diphtheria, which are caused by bacteria that are commonly found in the environment, there is always a risk of infection. Pertussis, on the other hand, is highly contagious and can spread quickly through a community. Not getting vaccinated against these diseases not only puts yourself at risk, but also puts others in your community at risk. Who should get the Adacel vaccine? Adacel is recommended for anyone over the age of 10 who has not received a tetanus, diphtheria, and pertussis vaccine in the past 10 years. This includes adolescents, adults, and seniors. In addition, Adacel is recommended for women who are pregnant in their 3rd trimester, as pertussis can be particularly dangerous for newborns. Your healthcare provider can help determine if Adacel is right for you based on your age, health, and vaccination history. How to get the Adacel vaccine. The Adacel vaccine is available from healthcare providers, including doctors' offices, clinics, and pharmacies. Your healthcare provider can help determine if Adacel is right for you and can administer the vaccine. In some cases, vaccination may be covered by insurance. If you are unsure about your coverage, you should check with your insurance provider. Adacel vaccine side effects. Like all vaccines, Adacel can cause side effects, although most are mild and go away on their own within a few days. Common side effects include pain, redness, or swelling at the injection site, headache, fatigue, and muscle aches. More serious side effects are rare, but can include allergic reactions. If you experience any unusual or severe symptoms after receiving the Adacel vaccine, you should contact your healthcare provider immediately. Frequently asked questions about Adacel vaccine. How long does the Adacel vaccine last? The Adacel vaccine provides protection against tetanus, diphtheria, and pertussis for up to 10 years. After this time, a booster shot may be necessary to maintain immunity. Is the Adacel vaccine safe? Yes, the Adacel vaccine is safe for most people. Like all vaccines, Adacel has undergone extensive testing to ensure its safety and effectiveness. While there is always a risk of side effects, the benefits of vaccination far outweigh the risks. Can the Adacel vaccine cause autism? There is no scientific evidence to support the claim that vaccines, including the Adacel vaccine, cause autism. This claim has been thoroughly debunked by numerous studies and scientific organizations. Adacel vaccine versus other vaccines. There are other vaccines available that also protect against tetanus, diphtheria, and pertussis, including the Tdap vaccine. The difference between Adacel and Tdap is the amount of pertussis vaccine in the vaccine. Adacel contains more pertussis vaccine than Tdap, which may provide better protection against pertussis. Alternative vaccines to consider. Boostrix. Boostrix is a combination vaccine that provides protection against tetanus, diphtheria, and pertussis. It is similar to Adacel and can be considered as an alternative option for individuals who cannot receive or prefer an alternative to Adacel. Boostrix is approved for use in both adolescents and adults. TD vaccine. The TD vaccine is a combination vaccine that protects against tetanus and diphtheria. It does not contain the pertussis component found in Adacel and Boostrix. TD vaccine can be considered as an alternative for individuals who require protection against tetanus and diphtheria but have contraindications to receiving pertussis-containing vaccines. DTaP vaccine. The DTaP vaccine is a pediatric vaccine that protects against diphtheria, tetanus, and pertussis. It is similar to Adacel but is formulated for use in infants and young children. DTaP can be considered as an alternative for individuals who require immunization against these diseases in early childhood. Conclusion: why Adacel is essential for public health. Adacel is an important vaccine that provides protection against tetanus, diphtheria, and pertussis. Vaccination is essential for protecting individual and public health, and Adacel is an important tool in the fight against infectious disease. By getting vaccinated with Adacel, you can protect yourself and others in your community from potentially deadly diseases. So, if you haven't received a tetanus, diphtheria, and pertussis vaccine in the past 10 years, talk to your healthcare provider about whether Adacel is right for you. While Adacel is an important vaccine for protecting against tetanus, diphtheria, and pertussis, exploring alternative vaccines is essential for individuals who cannot receive or prefer alternatives to Adacel. Boostrix, TD vaccine, and DTaP vaccine are viable options that provide protection against these infectious diseases. Working closely with a healthcare professional or vaccination specialist is crucial in determining the most appropriate vaccine for your specific needs. By considering factors such as age, immunization schedule, contraindications, allergies, vaccine efficacy, side effects, medical history, and availability, you can collaborate with your healthcare provider to make an informed decision and ensure you receive the most suitable alternative vaccine. Remember, vaccines play a vital role in preventing infectious diseases and safeguarding public health. With the guidance of a healthcare professional, you can explore alternative vaccines to Adacel and make the best choice to protect yourself and those around you. Thanks for watching.